Louisiana consistently ranks 50th in healthcare. You guys know this. Now we have more residents needing care. Our state needs all of the available healthcare professions practicing based on their education and preparation to provide services to the residents of our state so we can change that downward trend.
The projected demand for primary care providers from 2012 to 2020 is 1,473. An additional 1,419 primary care providers will be needed.
To say that you don't have enough airline pilots, now you're going to let the stewardess fly.
That's not an equal comparison. I don't think
you just can't do that.
That is nowhere. You could say the co-pilot.
Well,
That would be more. That would be a more fair analogy.
I'd like to just add that I don't think that any of these collaborative agreements in the other states have been around long enough to have studies done with any sort of power that we'd be willing to.
So do you know how long New Mexico has been in place?
We talked about that earlier for 30 years.
So 30 years is not long enough? You want it to be 60? We'll all be dead. Right here I have the Oliver Report, this latest research for Medicaid patients in those states who have removed barriers. It shows a decrease in ER visits, decrease in hospital admissions, decrease in hospital readmissions, increase in healthcare outcomes.
This particular agreement has no demonstrated medical benefits on patient safety, patient health, or patient outcomes. We have tons of research that patient outcomes are better where the mandated agreement has been eliminated. "22 states do not have a collaborative practice agreement, and I can guarantee you those people see Medicare patients. Medicare will allow you to see whatever your state allows you to see. If your state doesn't require a collaborative practice agreement, Medicare won't require it."
So what you're saying is that you're in a collaborative practice agreement with somebody that doesn't have to review any charts and doesn't have to visit? I mean, is that right?
That's correct. Collaboration is not supervision. There's a difference. Supervision requires the approval of the physician.
What is required of a collaborator exactly?
That they be available if we need consultation.
If you need consultation.
If we need consultation.
So basically, if you don't need consultation, they don't require to go into the clinic?
No, sir.
They're not required to look at a percentage of your charts?
No, sir.
So they're not in the clinic on a daily basis?
No,
They don't
sir.
have to come to the clinic? They don't
No,
have to
sir.
review your charts?
No, sir.
Some nurse practitioners never see their collaborator. Their collaborator never sets foot in their clinic, ever.
My physician who collaborates with me has only been to my office once in the last 8 years.
It does not expand nurse practitioners' scope of practice. What we do with a collaborative practice agreement, we will do without a collaborative practice agreement, no more, no less. The collaborative practice agreement is not a catalyst for true medical collaboration. I want you to please understand that we collaborate all the time. They call physicians, they call specialists, they call PTs, they call OTs, they call therapists. They will continue that with or without a collaborative practice agreement. NPs have had their own private practices and their own clinics for years, decades in some cases, and they will continue to collaborate. They collaborate every day.
While they have been excellent at interacting with patients and giving compassionate care, they were not prepared to be solely on their own.
To not have a physician to communicate and collaborate will decline the quality of patient care.
Hundreds of studies over the past 5 decades have demonstrated
clear and consistent evidence of nurse practitioners' high-quality, safe patient care outcomes. It's just the education and training and clinical hours are just not there. Nurse practitioners must have experience as a baccalaureate-prepared registered nurse and hold a master's degree. We remain accountable to the public and the State Board of Nursing. All nurse practitioners must pass a national certifying examination and must maintain that certification to stay licensed.
Unfortunately, although I'm a doctorally prepared psychiatric mental health nurse practitioner, and although by education and national certification, I am qualified to treat patients of all ages, due to the lack of a collaborative practice agreement with a child psychiatrist, I am prohibited from providing services to those under the age of 13. This inability to practice to the full extent of my education and certification resulted in children in my organization's service area having to wait as much as 6 months to receive a medication evaluation. These are children that could have been seen on site at the school if I would have had a collaborative practice agreement with a child psychiatrist. Let me tell you from experience, it is very, very hard to find a child psychiatrist.
6 years ago, the Institute of Medicine developed a groundbreaking report that said nurse practitioners and other APRNs should have restrictions removed, and they should be able to practice to the fullest extent of their education and training. The collaborative practice agreement does not provide any real health benefit, and it's logistically burdensome to patients and providers.
I just ask that you vote yes for Senate Bill 187 and allow us to do what we've been doing this whole time. Thank you.